I'm Amanda Whittal, Research Coordinator for the Foundation for Alternative and Integrative Medicine. FAIM's goal is to share information about health options with the public through the expertise of over 100 guest writer medical practitioners, as well as international projects to learn and share options for health that are available worldwide. All information can be found on our website at www.faim.org. And as part of this work, we regularly interview practitioners from clinics and health centers that we feel the world should know about. We hope you enjoy today's interview. I'm here with Dr. Henning Saupe from the Arcadia Praxisklinik in Bad Emstal, Germany, about 25 kilometers southwest of Kassel, for those who know. The Arcadia Praxisklinik is a treatment center for integrative medicine and cancer therapy, which has been combining the latest findings from scientific research and experience-based naturopathy since 1992 through a method known as the Arcadia Way to Health. And Dr. Saupe, welcome. Thank you for being with me here today.
Hello.
Really nice to have you.
Thank you for your audience. It's an honor and a pleasure to meet you here.
Pleasure's all mine. And I'd like to hand over to you right away. If you can just start by telling our audience a little bit about the clinic itself and what exactly is the Arcadia Way to Health?
Well, those are the questions. The clinic itself is a treatment center, as you already mentioned, in the center of Germany, beautifully located in a little curative village close to the city of Kassel, in between the cities of Hanover and Frankfurt. We're a team of 3 medical doctors. The entire staff is 25 people who take care of, at the maximum, 10 patients. Patients normally bring a spouse with them or a support person, so we can host up to 20 guests here at Arcadia Clinic. And our key message and what we do, our services to our patients, is complementary holistic medicine. So the next question is, what is complementary holistic medicine? And the shortest definition of it is the approach, the medical approach, to use the self-healing capacity of man, to use what is inherent within every human being, represented in our immune system, in our detox system, in the way to keep the body in homeostasis, in a balance of power, which is the best definition of health, if you ask me, and has been the definition of health in all the old medicinal philosophies of traditional Chinese medicine, Greek medicine, naturopathic medicine, which was the medicine that existed for thousands of years until something very interesting took place, and that is modern medicine, what we also call orthodox medicine or Western world medicine, that adopted more and more within the course of 100 years, starting at the end of the 19th century up to date, adopted a reductionistic approach to health and healing, where health was not any longer a balance of power, but the absence of symptoms. And that is what modern medicine is excellent about: to reduce symptoms, to repair a broken leg, to repair a joint that needs to be replaced by an artificial joint when it's worn out, or to help somebody in an acute state of life-threatening situation after an incident, after a heavy traffic accident. That is where intensive care in Western world medicine is excellent and has never been as good as today. But something got lost on the way to develop all these surgical techniques, the pharmaceuticals, the diagnostics. And what got lost is a concept of life, vitality. Vitality is what drives the body and keeps us alive throughout our life. All these 70, 80, 90, 100 years that the human body lives is based on an inherent phenomenon called vital force, vitality. Modern biological science has identified structures inside our cells, the mitochondria, that are the key drivers of cell energy production, and they play a very important role in all diseases, especially the cancerous, the oncological diseases. But regular Western world medicine, Western world oncology shows up to date very little interest in supporting the energy system of the organism, and looks only at what went wrong. What went wrong is there is a cancerous tumor growing, there are cells inside the body growing, threatening life functions eventually, And the focus is on eliminating what we don't want. This is the reductionistic approach that became the main approach and the main philosophical background of modern doctors, maybe 130, 140 years ago, up to today. And it's symptom-based. It's focused in our topic today, oncology. It's focused on the cancer cell. But the patient who comes to me has a problem, and that's not only the cancer cell. The problem is that his organism cannot control the cancer cell any longer, and that's a huge difference if you look from that perspective, or if you only look from the perspective of a cell that you want to eliminate and kill and get out of the system. So complementary holistic oncology is very much about the terrain, the whole entire living organism, the human being, around the phenomenon that cells grow and accumulate and eventually form a lump. And complementary medicine, the word means that we bring something to the already existing therapies. We're not in contrast or in opposition to mainstream oncology. We add a quality which is taking care of life functions, taking care of immune system detoxification, the flow of energy in the cells, so that the side effects of traditional oncological treatments get more tolerable. If you ask me, and if you ask patients who have gone through classic oncological treatment, the most challenging aspect are the side effects. Everybody knows that chemotherapy comes with enormously demanding side effects, and that's also the dilemma at the end of the journey with chemotherapy for many, many patients, that they don't tolerate the drug any longer, and that means they cannot get any treatments, and that defines the end of the treatments, the side effects. So complementary medicine, especially the way we do it here, prioritizes quality of life and uses non-toxic strategies as long as possible. And then the next question is, what are non-toxic therapies, and what is the playground that we look at when we talk about vitality and how to raise general vitality and the self-healing capacity of our body?
Indeed. And I think it's a great summary. Thank you so much. And I know you're doing a lot of great work. And indeed, how exactly you prepare this terrain and you support this terrain for quality of life is extremely interesting to us, particularly the therapies that you're using. And I do have a number of questions about what it looks like in practice. Before I get into that, did you want to speak more generally about what this approach looks like? Or
I can share an overview slide or a few to help our audience to understand better the terrain and what we talk about when we talk about holistic medicine and the holistic approach. I hope everybody can see the screenplay that I present here. Holistic cancer medicine, I call it a more gentle way to heal from cancer. So let me start once again with the philosophical background of holism. Everything matters in the system of our health system, of our organism. There is nothing that does not matter. What we eat matters, how much we sleep matters, how we deal with toxins, how we intoxicate ourselves with the waste products that we cannot get rid of, how we feel, how we handle stress. And every listener here knows what stress means. It has become a part of modern life that we feel stressed. There are too many demands, and the resources to handle the demands from stress seem to be not in proportion to what we can handle. So the holistic approach incorporates all aspects of our life, and I start with a beautiful picture that you can find in a very special and precious book of the time of the French king in the 15th century. It was painted by German painters in an orrery, in a prayers book for the Duke of Berry, who became later the King of France in 1400. And it shows man surrounded by 12 mystical, magical symbols representing the zodiac signs, and behind every zodiac sign there was a quality that represented a body type or a constitutional aspect that was mentioned in the old scriptures of Hippocrates, the ancient teacher and doctor whose teachings were taught at medical schools for more than 2,000 years. And in the Latin words in the corners, you find a description of the meaning of these 12 symbols. The message of this book, this picture, is that there is a circle of divine forces around the human being, and that man has this holistic divine background. And the doctor's main task is to bring these 12 aspects back into balance, the state of balance that equals health. So this picture inspired me to find the 12 aspects that represent health in modern language, in terms that we can understand with a scientific background. And this is my variation of this theme of a 12-fold energy grid around the human body from the 15th century, transferred into the 21st century with modern concepts of biology and physiology. So I identified 12 different healing factors or health aspects or vitality aspects that I mention as the circle of energy fields that need to be in balance so that we live a healthy life. And what my book is about in the first chapter is to explain what health is and what vitality is. It's a balance of inflammation and inflammation control. Inflammation is a body-owned self-healing program that has helped us hundreds of times to recover from infections or minor damages or injuries. And we need to be able to switch inflammation on, but we also need to be able to switch it off when it has done its work, so that we don't go into chronic inflammation, which is the beginning of a chronic disease. Second aspect is everything that has to do with toxins, the capacity to detox external and internal toxins. The third aspect is nutrition and everything that belongs to nutrition. We need around 90 different nutrients a day to keep our organism in balance, and there are many aspects of nutritional abundance versus nutritional deficiency that we need to address when we look at chronic diseases. We need water, so there is a chapter for water in my book, what we can do to replenish the storage of water in our body and keep the water supply in a perfect, healthy manner, so we can excrete the toxins and get the water we need for all the biochemical reactions that define our biological health. We need oxygen, we need a proper gut flora, we need strategies to handle stress. We need sugar in our blood that drives the brain and our cells, but we need to be able to control the blood sugar level within healthy limits. We need an immune system for sure, and the immune system needs to react appropriately to the demandings. We need energy, and the source of energy are these tiny little compartments in our cells called mitochondria. So there's a chapter about mitochondrial medicine and how we can support the energy plants inside our cells with perfect food and with good detoxification and maybe some food supplements. There is an aspect of alkalinity and acidity that needs to be in balance. That is one field where food plays an enormous role to handle the balance between these two qualities of alkalinity and acidity. In all chronic diseases come with an excess of acidity, so we need a more alkalizing diet and alkalizing therapies. And of course, we need an infection defense that keeps the boundaries between us and other organisms in a healthy proportion. So this is a very short outline of the 12 vitality factors that I present in my book, and that is transformed in a treatment plan for patients at our clinic. And if we look at the opposite of that, we have the factors that attract cancerous diseases and sometimes also other chronic diseases. It's silent inflammation, it's toxicity, it's a deficiency of nutrients like iodine and omega-3 fatty acids and some essential vitamins like vitamin C, vitamin D, and many others. So nutritional deficiencies represent a very important factor that adds to the risk of developing a cancerous disease. water deficiency, oxygen deficiency, unhealthy gut flora, too much psychomental stress, too much blood sugar, and as a consequence of too high blood sugar for too long periods of time, the production of too much insulin, which is a growth factor for cancer and a pro-inflammatory factor. All these disturbances mislead our immune system, so the immune system is out of balance, doing too much inflammation, doing too little to control cancer. We get more and more mitochondrial damage, which means the flow of energy in our cells is not optimal. And yes, cancer is, amongst many things, a mitochondrial disease. Cancer is the consequence of a deficient mitochondrial energy production. So everything we can do to support our mitochondria will help us to live longer if cancer has become a fact in our life. Over-acidity, as I already said, is a factor that contributes to chronic inflammation and cancerous diseases, and chronic infections can do the same, contribute to chronic diseases, inclusive cancer. So this is the cancer map. If this biological factors have been the dominant factors in somebody's organism for a too long period of time, cancer can be the consequence of this intoxicated, inflamed, out of balance terrain. So now we have a map. This is the map that we can use to find a way out of this dilemma. And the therapies that we provide represent the way out. We provide anti-inflammatory treatments. We provide detox treatments. We do in-depth laboratory tests to find the nutritional deficiencies and replenish the nutritional deficiencies with good food and supplements. We provide excellent purified water and encourage our patients to drink more. We work with oxygen therapies. We look into the gut flora and make a microbiome analysis to find out the needs for probiotics or gut repair. We work intensively with psycho-emotional and psychomental aspects of the disease, and offer our patients lectures and individual sessions on mindfulness thinking, on stress reduction, on meditation, on energy balancing strategies like EFT, emotional freedom therapy, and others. We work on the blood sugar. We work with the immune system with certain drugs like mistletoe, Japanese mushrooms, proteolytic enzymes, and other naturopathic drugs. We work intensively on mitochondrial health and power with inhalation therapy or magnetic stimulation. We balance the over-acidity with alkaline food. And if there is a chronic infection, we need to find it, identify it, and cure the infection with appropriate drugs. So this is an outline of what we do here. And maybe as the last slide for this short presentation, we acknowledge the fact that mind and body acts in concert. It's not in two worlds, it's in one world, that the mind and our body exists and work together. And this was honored with the term psychoneuroimmunology around 25 years ago, when psychoneuroimmunology became an accepted academic discipline with institutes for P&I, psychoneuroimmunology in all major universities around the globe. So in plain English, it means that our emotions and our immune system is intimately connected with each other, and that every emotion that I produce, that I feel, interacts with my immune system. And the phrase that says it in very, very strong and clear words is from a textbook on psychoneuroimmunology by Professor Christian Schubert from the Institute of P&I from the University of Innsbruck in Austria, where he says, there is no difference between our feelings and our immune system. That's a very, very powerful phrase. That means be careful what feelings you allow you to have or what feelings you produce, and change the quality of your feelings if your feelings are not supportive to your health, to your life, and to your healing journey. And that's what we work very, very intensively with: emotional aspects, inner healing, spiritual aspects of the disease. So may that be the presentation for this time, and let's continue with your questions.
Thanks so much, Dr. Saupe. And I think it's quite an impressive holistic map. I really, really like it. I really like this flip side where you can see where cancer originates from. And there's so many different elements that you address during the treatment plans. I probably have a million questions that I have to squeeze into our 15, 20 minutes. So I'll try to be maybe pointed to some of the aspects that our audience might know a little bit less about. So I think that things like nutrition and having adequate water are all extremely important. I maybe won't go into them as much because I think there's a higher level of understanding. But if we think about some of the treatments within the individualized plans that you do to cover these different areas, I'd really be curious to just understand how they work, if you always incorporate them. So for instance, I know you do insulin potentiated therapy as one element. And I'm just curious, in the overall treatment plan, where does this fit in? Is it always a treatment that you include? Can you tell us a little bit more about it?
Yeah. So the first step is individualized assessment. We need to understand what does this patient need and what does that patient need. And two patients with breast cancer can have totally different types of cancer, different entities of deviant cells that need to be treated in two different ways. And that is why individual testing, individual assessment is key. It's so important. So there is no one size fits all in oncology, and that's for me one of the biggest pitfalls of regular oncology, that it defines the guidelines for a whole category of cancer. Let's say breast cancer, the most common type of cancer in the world. And today we know there are no two patients alike. Yes, there are overlapping aspects, there are similarities between different types of breast cancer, but the genetic background and the genetic profile of two different patients suffering from breast cancer can be enormously different. So we have an enormous heterogeneity of cancer subtypes to deal with, and that is why we use individual assessment. So all our cancer patients with manifest cancer get tests from a laboratory in Germany, in Düsseldorf, that is specialized on chemosensitivity analysis and tumor gene analysis. A chemosensitivity analysis can be made with circulating tumor cells. Yes, cancer patients with manifest cancer do have circulating tumor cells in their blood. And we can use these cells to do a chemosensitivity test at the laboratory, and within 6 days, we get the test result back that tells us that this particular patient and her cancer cells are very sensitive to drug A, B, and C, a little less sensitive to drug D, E, and F, and not at all sensitive to X, Y, and Z. So instead of using the guideline, we do individual testing. An even more in-depth testing would be a complete gene analysis that requires a biopsy, and many of our patients have understood that that is the best way to know as much as possible about the biological oddities of their personal cancer. And a gene analysis today can detect 20,000 gene variants in a cancer sample. That is almost the entire human genome. Human genome incorporates about 22,000 genes. Every gene is a building instruction for a protein and defines the biological pathways of a cell. So with an almost complete gene analysis, the laboratory can give us a map of the biological pathways that the cell uses to survive in the patient's organism. And the more we know about these pathways, the more we can use smart drugs to block the pathways that keep the cancer cells alive without doing too much harm to the rest of the body. So individualized testing. Then we do microbiome analysis to find out the quality of the microbioflora, the intestinal flora of our patient, because immune system and gut flora is intimately connected to each other. A large portion of the maturation of our immune cells takes place in our intestines. So, and the quality of our microbiome is of utmost importance for the maturation of our immune cells. So gut flora is also a key factor. We do heavy metal analysis to find out if there is an intoxication issue that we would answer with special detox procedures. Not everybody needs that, but if you have a high mercury, a high lead count in your blood blood samples, then you need more special anti heavy metal detoxification procedures than other patients who don't have that issue. Then there are things that everybody needs, and that is general improvement of the inflammatory control and reduction of silent inflammation, the little sister of acute inflammation. Everybody knows what acute inflammation is. That is what we suffer from when we are infected, common cold or mechanical injury. Our body responds with an inflammatory reaction, and that is needed to overcome the crisis of being infected or repair a damaged part of the body. But silent inflammation is the consequence of all these factors, the unhealthy factors like toxicity issues, deficiency issues, stress issues, high blood sugar, and our body responds with silent inflammation that creates eventually a terrain where cancer cells thrive and become the dominant cell form to survive in this chronically inflamed area. So everybody, almost everybody needs, I would say everybody needs anti-inflammatory food. By the way, Western world lifestyle is characterized as being too much pro-inflammatory. And what is that? It's too much sugar, it's too much red meat, it's too much alcohol, it's too little sleep, and it's too much stress. And all these factors, alcohol, red meat, sugar, lack of sleep, lifestyle factors add to the overproduction of inflammatory activities in our body, and by doing that we create a cancer supporting terrain. So we all need anti-inflammatory food which is more plant-based, more fresh and raw, not so much cooked, a good mixture between raw and cooked food. Yes, we also need cooked food. If you ask me, I'm not a raw food totaler, but I inspire my patients and encourage them to define their meals with a portion of raw food and a portion of cooked food. We need less carbs. We suffer from a carbohydrate intoxication, especially in the United States. The part of carbohydrates on our plates are it's too big, too much carbs, that results in an overproduction of insulin, and that opens the door for cancerous diseases. So a lot is to say about food. Anti-inflammatory is one of the big guidelines for me for what diet I choose. It's described in my book. A few words about the gentle way to treat cancer. How do we get out of the dilemma that cancer cells are stubborn and need strong energies to be blocked? A cancer cell does not stop its vivid activity to grow and to multiply in our body with only soft therapies. The terrain treatment is extremely important, but it is many times not strong enough to push an existing, growing, progressive, aggressive cancer into remission. So how do we do that? And I want to mention two tools that we use to block cancer growth, and we do it in a less harmful, less aggressive manner that does not do so much harm to the rest of the body. And the first is what you already mentioned. It's called insulin potentiated chemotherapy. And it means that we lower the patient's blood sugar with a little bit of IV injected insulin, the hormone that controls blood sugar. And within 30-40 minutes, we cause a drop of the blood sugar level from normal, let's say 95 milligram per deciliter on an empty stomach, which is a normal empty stomach blood sugar level, down to around 50-45, which is the level of where you feel a little dizzy, a little weak. It's like jogging on an empty stomach. That's about the feeling that the patients have. And we do that under strict blood sugar control, and the patient is connected to a monitor so that we make sure that we do that in a very, very safe manner. But when the blood sugar is that low, cancer cells are weaker than other cells because they are more dependent on glucose. They drive more their metabolism on glucose than healthy cells. And if you take away their main fuel, glucose, if you lower blood sugar, cancer cells get extremely stressed. And that causes an opening of their cell walls for the influx of drugs. They open their mouths, so to speak, their channels for drugs, for glucose and drugs. And if we use this moment where blood sugar is low and cancer cells weak and hungry, we can save dosage. We can apply around 20% of the dosage of what a regular protocol recommends. And the 20% seem to give a good result and sometimes much better result in terms of cancer control compared to the 100% under normal blood sugar levels. This strategy was developed around 80 years ago in Mexico by a former military doctor and surgeon, Dr. Garcia Perez. And since that, in the 1940s, he did it with in combination with chemotherapy. So he's the grandfather of insulin potentiated low dose chemotherapy. He also did it with antibiotics for infectious diseases. It was quite impressively successful in the treatment of syphilis, which was a big problem at his time. So with the primitive antibiotics that he had at hand in the 1940s, together with insulin, he was able to cure many patients suffering from syphilis, long before more potent antibiotics were available. And a little later, he tried the same combination, insulin plus a drug in cancer, and combined cytostatic drugs with insulin and saw that it was very successful. And since that, many generations of doctors have been educated by him, his son, and eventually his grandson to learn how to use insulin as a treatment enhancer. So I learned it from his grandson with the same name, Dr. Donato Garcia Perez III, who is now a gentleman in his mid-70s, still very active, still leading a hospital in Tijuana, Mexico. And I learned it there. And ever since that, I incorporated it in our clinic. And it works very well. So the patient does not feel any side effects from the cytostatic drugs. The patient feels the shift in blood sugar and the shift in concentration and a little dizziness, but that is tolerable. It lasts for 2 hours, and then we raise the blood sugar again with appropriate injections of glucose. And that's it. No side effects. We don't see any alteration of blood values. Bone marrow damage is not seen. Liver function, kidney function, all remains very, very good. And that's the way we push cancer back in this part of our work, where we say, okay, we also need to do something to reduce cancer growth with an addressed attack. But it's more specific. We can say standard oncology protocols are not always successful because of a lack of specificity. They kill too many good cells. They kill too many bone marrow cells and liver cells and brain cells. And that is why the situation is as sad as it is. And by the way, I do not speak about the advantages of modern chemotherapy in blood cancer, leukemia, lymphomas. These blood-based types of cancer are much more sensitive to standard chemotherapy, and the success rate is much higher. If I say cancer, I mean the many hundred types of solid cancer that are also called carcinomas, where the most common ones are breast cancer, prostate, lung cancer, colon cancer, pancreatic cancer. All these types of cancer are not as sensitive to chemotherapy as the blood-based ones, and that is the large group of cancer patients that look for alternatives with a better quality of that give them a better quality of life and less toxicity and a more long-lasting effect to keep the disease at bay.
Yeah.
And that is my message to everybody in a stage 3 or 4 of cancer with distant metastases, that the goal is to keep the disease at bay with a good quality of life for a long period of time. We have to acknowledge that today there are no guaranteed ways to heal stage 3 or 4 cancer. It's a chronic disease. So the strategy to kill cancer by all means with the highest possible and tolerable toxicity is the wrong way, if you ask me.
Yeah.
So we need to redefine the goal. The goal is to make the disease manageable and to live 20 years with it. Same goal as we have with multiple sclerosis, rheumatism, many chronic diseases that we cannot heal but treat successfully.
Very well said. And I think it really just reflects your whole philosophy to work with the terrain, and still at the same time acknowledge that this chronic illness is something that has to be sometimes dealt with stronger. And I have so many questions. I wanted to flag to you, though, that we have about 5 minutes left. You've given us already such a good insight into what you're doing. I might have to ask you back at some point to learn a little bit more about the details. But I think in terms of understanding how you address it and how cancer can be addressed in a more holistic way, it's been such a nice time to learn from you. Thank you so much. And I would also like to point our audience to some of the work you've done. I know you've published your book, and for people who'd like to know a little bit more, in addition, how they could get in touch with you if they wanted to, can we just share that information before our time is up?
Well, because this topic is extremely interesting and important for everybody, it's a sad truth that we are heading towards a 50% lifetime risk to develop cancer. You and me in a few years face a 50% lifetime risk to get a cancerous disease during our life. At the moment, we're around 40% lifetime risk in average for people in the Western world. And every year, 1 to 2% is added to that risk. So we all have reasons to learn how to balance our body and how to stay away from developing a cancerous disease. And that is why I wrote this book. It took me 10 years to accomplish it. And alongside my clinical work, it was published 2 years ago, first in German, and then this is the English version from Chelsea Green, publisher in Vermont, United States. You can buy it everywhere where you can order books, online or in your local bookstore. And that's a field guide for everybody and a self-empowerment book that you can read so you understand what you can do when cancer has knocked at your door, and that the reductionistic approach of your oncologist is not all there is. It might be a very important part of your treatment, but you can do so much more than just accepting radiation and chemotherapy. And I'm still surprised that nutritional medicine and simple detox methods are not shared with patients, although the overwhelming amount of clinical data and evidence that it is essential and successful. So, and how can patients reach out to us and find us? That's not difficult. This is how our clinic looks like. It's a privately run clinic located in a park in a curative village outside the city of Kassel, right in the middle of Germany. We pick up our patients at Frankfurt International Airport and bring patients door to door. We have our own restaurant, and we take care of patients like family members. And we work intensively with the patients that see us. We have hosted patients from more than 50 different countries. The average stay is 3 weeks, depending on the patient's need, but 3 weeks is a good start. And then we stay in contact with the patients by online follow-up meetings, and we send patients home with a home care package and provide them with drugs that they can use at home. And this is how we can be reached. It's our email address that goes to my secretary, Tanya, or to my office manager, George, info@arcadiapraxis.de, and the telephone number. So Arcadia Praxisklinik in Germany. And it all starts with your application with an email, and then we get back to you and offer you a first video consultation where we provide you with the information you need in order to make a good choice.
Fantastic. Dr. Saupe, thank you so much for everything you do, for taking the time to give our audience some great information and a starting point for where they can go. And wish you a great day. Hope that we can have you back for further conversations in the future.
Always. Thank you so much, Amanda.
Thank you.